Hi everyone. Today we're going to talk about hair loss in women. There are a few primary underlying causes of hair loss in women. One is hormonal imbalance, two is nutritional deficiency, and three is autoimmune. So let's talk about hormones first. This is by far and away the most common reason for hair loss in women. But there are many different causes of different types of hormonal imbalances. One, low thyroid can lead to hair loss that's pretty diffuse and uniform. High thyroid can also lead to hair loss. I often will see hair loss in women that are entering perimenopause when the estrogen becomes lower than it used to be. That is a huge trigger for hair loss in women. And then menopause, when estrogen finally drops and stays low, can be a huge trigger for hair loss. Also, when women have too many androgenic hormones compared to estrogen. So when you have too high of DHEA or testosterone compared to estrogen, that can trigger extreme hair loss, but usually this time it's mostly localized to like the temples and the top of the head, the crown of the head. Oftentimes when that's the case, the hair is also oilier, whereas hypothyroid related hair loss is, like I said, uniform, diffuse, and the hair is typically drier. So have your doctor look at all of those hormones. And then the second main area that leads to hair loss in women are nutritional deficiencies. Iron deficiency is a huge cause of hair loss. A woman doesn't even have to have anemia. So it could be iron deficiency and just kind of borderline anemia, and that can lead to hair loss. So if women are having extremely heavy periods, perhaps also either not getting enough iron in their diet or malabsorbing the iron that they're eating, that can exacerbate the heavy menstrual cycles, iron deficiency, and lead to hair loss. There's even some information to suggest the opposite, that women can actually have hair loss from low copper and high iron. So I would highly recommend that the mineral balance is looked at. And then you want to ask if there are deficiencies and there's no obvious cause of, like, let's say low iron from heavy bleeding. You want to ask the question, are you A, getting enough iron in the diet or enough minerals, or B, are you malabsorbing what you're taking in? And if it's malabsorption, why is that? Do you have a food you're eating that you're allergic to? And is that creating an immune reaction in your intestinal tract that's blunting your absorptive capacity? There's some deep questions to ask. And then finally, some women will lose hair because of autoimmune reactions. So there's alopecia areata, for example, where a woman will lose hair in a very discrete area, almost like a well-demarcated circular patch will be completely free of hair. And then the hair will look fairly normal all around there. Or maybe there's a series of patches. So that's an autoimmune type of hair loss. There's also Alopecia totalis, which is where all of the hair follicles are attacked by an immune reaction. And then unfortunately, in the current era, we're seeing hair loss, which I believe is immune in nature, related to COVID infections. Some unfortunate women have even mild cases of COVID and then progress beyond that to lose like a third to half of their hair. The good news is that this grows back eventually, but it can be incredibly disconcerting after effect of having COVID in some women. There is even some of my patients that we feel very, very likely have lost hair from the COVID vaccine. So, whether you have spike proteins and you're making antibodies to those in a natural infection, or you are making antibodies to the spike proteins from immunization, it is possible that the spike proteins are somehow interacting with the hair follicle and leading to hair loss, or the antibodies to the spike proteins are interacting with the follicle and leading to hair loss. This is theoretical because I don't think anyone's really established the actual mechanism, but it is happening. So the good news is that most of these causes of hair loss that I've just mentioned are reversible. So I've helped many, many, many patients over the years grow their hair back and figure out why they're losing hair in the first place. Even the autoimmune hair loss, there's a lot of hope for that. So in that case, you want to find out what's triggering the immune system to begin reacting to the hair follicle, and what are the perpetuating factors involved in that case. And oftentimes with some deep digging, you can sort that out and reverse it. So for growing hair back, there's some good nutrients that can be helpful. Just, once you've kind of identified the cause of the hair loss, there are things you can take to help your hair grow back. And one of them is actually a topical treatment, and it's over the counter, and it is pharmaceutically based, but the topical minoxidil will enhance blood flow to the hair follicle so that nutrient delivery to the hair follicle is more effective, and that can help facilitate the hair growing back. So there is a place for that, and a lot of women find it beneficial. And then just nutrients that you can take orally for hair. Like one of my favorite products for hair loss in women is the Nutrafol for women. And that's got a mixture of a variety of like marine peptides and adaptogenic herbs like ashwagandha, and even sal palmetto, which is reducing the conversion of testosterone to dihydrotestosterone, which is what binds to the hair follicle in the androgenic hair loss in women. So anyway, have heart, there's a lot that can be done.